Hi, this is Dr. John Stewart. I am the Deputy Director of the University of Illinois Cancer Center and the Principal Investigator for the CSTAC initiative. A particular challenge that we have in our community is making sure that we provide continuity of care for patients with cancer. I think that it's important that as workers in health equity, we seek to eradicate disparities in the Chicago communities. However, there are a number of challenges associated with navigating the complex medical treatment that patients with breast cancer have. So first is access to quality care. And living in medically underserved areas, women are typically underdiagnosed due to the fact that there is limited access to screening. At the University of Illinois Chicago, we're seeking to address this issue by having a number of open appointments at our federally qualified health center to address this. In Chicago, there are a large number of patients who live below the poverty line, and therefore there are specific challenges associated with employment situations, obtaining childcare during screening and treatment, as well as transportation. There's longstanding evidence that supports the fact that providing this level of safety net support for these patients do improve outcomes in individuals with breast cancer. And then there's the long wait times for follow-up care after an abnormal mammogram. A number of navigation programs, including those at the University of Illinois Chicago, are actually seeking to decrease these wait times for women who have abnormal mammograms through early communication and focused guidance through the diagnostic process. So what are some of the challenges that patients face during treatment of breast cancer? Number one, there's low health literacy. In other words, there's a disconnect sometimes between the available information for the patients and the actual appreciation of said information and the dissemination of that information in the community. CSTAC is seeking to address these issues by increasing health literacy and increasing communications with our communities to improve these outcomes. As was mentioned before, sometimes there are delays in the time from screening to diagnosis. Likewise, there are delays in the time from diagnosis to treatment. There are financial barriers associated with treatment for breast cancer that we are actively seeking to overcome as part of CSTAC. And then finally, there's surrounding topics of medicine and healthcare. At the University of Illinois in Chicago and with CSTAC, we're seeking to overcome this by being ever present at the community and discussing important issues pertaining to not only cancer, but also things such as infant mortality, maternal mortality, gun violence. All of these are the unfortunate consequences of structural violence, and I believe that as a cancer center, we have to address these to take a holistic approach to our patients and their disease. So, what impedes patients' continuity of care? We mentioned before access, insufficient capacity, and even geographic distribution of said capacity, lack of finances, difficulty in arranging childcare, having uneven employment opportunities in which treatment can result in missed work, and the inability to afford transportation during treatment. Another health system level barrier is the infrastructure that we sometimes employ to take care of these patients. Because there's no nationally centralized electronic medical record system, sometimes patients who receive care at multiple institutions often have big gaps in their care that's based upon the fact that their treatment institutions are not aligned. So, what can we as a health system do to connect patients with the right services and education at the right time? We think as part of our quality initiatives, it's the right patient, the right treatment at the right time in the right place. So I've mentioned patient navigators fairly frequently during our time together, and patient navigators seek to assist patients through their entire breast cancer journey, from an abnormal screening to diagnosis to treatment and to survivorship. Unfortunately, patient navigators are not reimbursed by third-party insurers, and so this is an investment that health systems have to make to improve the care the continuity of care, and outcomes for their patients. Secondly, health systems need to make sure that they hire culturally competent staff that can identify with the patients and the patients can identify with them, so that there is the building of trust, there's the appropriate level of communication in order to get patients through treatment, but also being able to provide culturally competent care to the patient's family and caregivers during their time of treatment. Health systems must also, thirdly, provide education to patients at all steps of the continuum. We've done a great job of that with our community outreach and engagement programs, and we're beginning to move toward the end of this patient continuum with building up of our survivorship programs. As I mentioned before, health systems must build trust in the community, and I think that health systems must do that through sweat equity. And when I say sweat equity, it's going to the community, having the community pose important questions that not only drive our care models, but also drive our research to address the needs of those communities. As health systems, we also need to improve provider communication. And so when I say provider communication, I mean communications between physicians and patients, nurses and patients, front office staff and patients. All of that should be improved so that we can continue to have an outstanding care experience for our patients. We must also have access to quality healthcare centers, and included there are a number of designations for outstanding breast care centers and healthcare centers, and those designations are readily available. And so I think of the Commission on Cancer certifies breast cancer centers. Of course, the National Cancer Institute designates cancer centers of care, and even Blue Cross centers of excellence allow patients to understand that the treatment that they receive and the staff and the facilities in which they're getting their treatment have been reviewed and certified by third parties. And finally, health systems must provide programs that aspire to provide precision medicine. So precision medicine is one of the latest advances, and the goal of precision medicine is to give the most effective treatment at the right time for each patient's breast cancer by understanding the molecular determinants of outcomes for those patients. In other words, if you've seen one breast cancer, you've seen one breast cancer as a treating physician. Again, understanding the mechanisms by which these breast cancers grow and evade the immune system will provide significant dividends to improve outcomes in patients. So, over our time together, we've spoken about promoting health equity to eradicate disparities. We've talked about addressing challenges during treatments. We've spoken about issues that impede the continuity of care, but then we've also set a framework for understanding what health systems can do to connect patients with the right services.